1. This is RTP. This is RTP180.
Thank you. Thanks for having me, everybody. So I am Beth Thomas. I am not going to talk about the North Carolina Biotechnology Center tonight. That is where I work, and if you want to talk more about it, I'm happy to talk with you about it later. But what I'm going to talk about today is the life-saving side of military technology. You always think about weapons and drones and tanks and everything, and you know what? This is a population of people that put themselves on the line every single day for our nation. It is an incredibly vulnerable population that needs great life-saving technology, and North Carolina has great examples of how we help them save lives. And so, before I go any further, I'm not going to present the complicated slide that Stephen had, but just so you're aware, the U.S. military is a gigantic organization, and most of their medical research actually happens through its largest service unit, which is the Army. So Army Medical Research and Material Command, and get used to the acronyms, it's MRMC. They focus all of their time and energy on creating mission-driven solutions for these 5 areas. And so I'm not going to go into the detail there, but I think I've just tried to simplify it so you understand that the mission-driven part is incredibly important. And I think a good example in the past was in World War II. The military helped scale up the use of antibiotics to save soldiers. And if you look back at the data now, the use of antibiotics at the end of World War II helped save between 12 and 15% of Allied forces' lives. And so it's creations like things like that we always have to be thinking about as we move forward. But it is a complicated area. And one of the things I wanted to kind of make it real for you is just point out a couple of examples in North Carolina where we're doing amazing stuff. And so first example is a company called Medicago. It's just down the street. It is actually a Canadian company, but they have their main headquarters manufacturing plant right here off of 54. It has a proprietary technology that the DoD, through DARPA, was super interested in because they needed to create a rapid production mechanism to create new vaccines. And so in 2011, through a DARPA Blue Angel Award, Medicago planted their plant right here in North Carolina. And they have an amazing facility there that is a rapid production mechanism that is based on tobacco plants, a proprietary tobacco plant that they have. They're able to transfect that with vectors that allow it to make unique proteins. And on the end of it, they create vaccines. That's a super simplified version of it, but that's the main concept. And I think, importantly, what DARPA needed to get to is rapid, scalable, accurate, and versatile. Rapid is super important for the military. Current vaccine platforms in egg-based vaccines take at least 6 months to develop a vaccine from beginning to end. Through the Medicago method, they can get there in 5 to 6 weeks. And in 1 month, they can develop 10 million doses of a vaccine. So this is incredibly important for these emerging infectious diseases that the military may have to deal with anywhere in the globe. So that's one example. Example 2 is more of a targeted healing solution. So Keratin Biosciences is actually located in Winston-Salem, but they have they're an advanced biomaterials company. Their whole company is based on a key skin protein called keratin. And your hair is basically just keratin. And what they do is they can isolate that. They have a proprietary technology that modifies it, and it creates a healing topical agent that can be applied to both wound healing as well as burns. Burns are a huge issue when it comes to a lot of theater injuries. They're incredibly painful, and you need to get them healed fast, otherwise they're going to get infected. And so having better healing topical agents is also incredibly important. And finally, my third example is a company also just down the street called Humacyte. Humacyte is kind of the next generation of medical technologies that the military is supporting. It is a regenerative medicine company. It came out of Duke University Technology. It is an award-winning technology. It is breaking barriers all over the globe. It is a bioengineered vessel. And so what that means is they're able to create the vessel in the lab under GMP and GLP standards so that when it leaves, it is basically an off-the-shelf vessel. And so if it is on the shelf, then if a soldier experiences a major trauma and loses a vessel, instead of having to transplant, find another vessel somewhere else in their body and move it, or all this other challenging surgical procedures, they can go to the shelf, pull the vessel off, and since it is the way they've prepared it is acellular, it will not have a rejection response. And so it's an incredible technology that represents the future of medicine, and the Army is supporting it in a big way. They have a number of funding vehicles that they access through to support this, and it is a critical technology that the Army is developing, and it will eventually get deployed for their soldiers in theater, but also for citizens all over the country. And I will finish up by saying, please support your military. They need you, they have big problems, and I put your because most of the time people care about it more if it's yours. And so it is ours, but I want you to think about it as if it's yours. And so thank you very much.